So my name's Sam Edmonds. I'm the Silver Rainbow National Project Manager at the National LGBTI Health Alliance. The project we look after, Silver Rainbow, is around LGBTI inclusive ageing and aged care, and that involves providing LGBTI inclusivity training across Australia through our partners in every state and territory. Some of the issues for LGBTI older people was particularly, not being recognised within aged care, not being recognised as being a part of the aged care system. Some of the sort of common things heard back then, not so much now, was, we don't have any of those people here, or not recognising that LGBTI people are older and are engaging in that system. You then have lifelong issues of discrimination and stigma and exclusion by the very institutions that people now need to access to get services. So there's a lot of fear and resistance to engaging with the aged care system as well, because they're not sure that it's actually going to be safe or inclusive. So it was sort of recognising, I guess, those two aspects. The one, the aged care system not acknowledging LGBTI people and older people, and two, LGBTI older people not wanting to engage with the system that actually discriminated against them for their whole life. So elder abuse is experienced differently within LGBTI populations, and when we say, we use the acronym LGBTI, but we recognise that, there's different experiences for people who are lesbian or gay or bisexual, trans or gender diverse or intersex, and we need to try and break that down a little bit more when we're looking at elder abuse. Like when we are looking at elder abuse, that we really need to look at the specific and particular needs of LGBTI people. I think, as I've sort of touched on, there are some really specific issues that people face, and these don't always get caught up in general discussions around elder abuse or in general responses to elder abuse, or they're not actually sort of seen as elder abuse in the same way that maybe other abuses are seen. So it's whenever we're considering and responding to anything, we need to actually, break it down and look at the different communities and different groups within older people, and then layer that with, being LGBTI, and then there might be other intersectionalities as well in terms of culture or language or spirituality or background that also needs really specific consideration. The Elder Abuse Conference, I think, is a really great starting point to start these discussions around the impact of elder abuse across diverse communities. The program itself covers LGBTI as well as cultural and linguistically diverse and Aboriginal and Torres Strait Islander people, amongst other diversities, and these discussions need to happen to start driving that change and driving the creation of, whatever the next steps are from the conference. And I know there will be a day following it where we'll be looking at more of a response and what needs to happen. So the conference is a really great starting point of getting those discussions happening out in the community.